Hello, my name is Dr. Lars Eric Larson, and I'm a chiropractor. In the next 30 minutes, I'm going to review some fundamental health information that's applicable to everyone. Some of my talks are very specific, but they all involve basic health tenets. My mission is to educate and to check as many individuals and families as possible in regards to their spinal health and those conditions affecting the spinal health. Now, today's topic will be arthritis, and I prepared a slideshow, so let's start by taking a look at our very first slide. And it says arthritis, reversible, treatable, preventable, and learn the facts. Hopefully I can provide some of the facts to you today about arthritis. Now, there are several different kinds of arthritis or types of arthritis, and we'll go through some of those different ones. But I want to focus on one specific type of arthritis, and that's the most common, which is called osteoarthritis or degeneration. Let's take a look at our next slide. As you can see, we have degenerative or osteoarthritis. We have another category, inflammatory arthritis, and that involves some things that you may be familiar with: rheumatoid arthritis, lupus, or ankylosing spondylitis. Another type of arthritis would be a metabolic type, and the most famous one there would be gout. Now, as I said, of all three of these types of arthritis, the most common is a degenerative type. And that is when the spine or one of the weight-bearing joints, most likely, gets involved, and the bones stop moving properly, and the joint gets affected, and then you see a lot of calcium building into the joint. And typically, this is not an inflammatory type, so that's how we can distinguish between osteoarthritis and some of the other arthritis, which actually involve a lot of inflammation around the joint. Let's take a look at our next slide. This is inflammatory or metabolic arthritis. And the first one, inflammatory, painful soft tissue swelling of joints. And when we're examining someone, we'll see symmetric small joint involvement. And this could be typical of rheumatoid arthritis, probably one of the most famous in this category. And the other one would be metabolic arthritis, and that has uric acid crystals, usually involving food and the way your body's processing food. And what will happen is these crystals will get deposited within the joints, and that causes a lot of inflammation, and the most famous one here is gout. Now, what happens with a rheumatoid arthritis is that you'll get a lot of fluid buildup within the joint. Say it's affecting your fingers, and so you'll see a lot of swelling right at the joint level, and you'll see all of the joints being affected, and a lot of times people's fingers will appear crooked too, as the inflammation really affects the way someone can even move their hands. Now, what that's happening in there is there's fluid buildup, and rheumatoid arthritis is an autoimmune disease. So this is truly a situation where your body has lost the ability to distinguish between its own tissue and something that's foreign. So it's actually attacking its own tissue. So in a rheumatoid arthritis situation, you have the body literally going after the joint capsule, and you may see it in the fingers, the toes, the wrist and hands. You might even see it in the spine too. So rheumatoid arthritis can affect a lot of different areas. Gout most typically is a different type of arthritis, and that would be metabolic, okay? And so that's going to involve how your body's processing foods, and there's a lot of relation between poor diet choices and gout. Typically, the most common spot we'd see gout would be down in the toes, the big toe, and you'll see inflammation there too, and it's very, very painful. Let's take a look at our next slide. This slide shows us degenerative or osteoarthritis, and this is the most common. As you'll see on this slide, we have two pictures, one normal, and the other one says degeneration. Now, on these two pictures, you have to understand that there is a normal curve to the human spine. This is a picture of the neck, and in addition, there should be proper joint spaces between the bones, meaning nice, big, healthy discs. And what will happen with osteoarthritis is that the disc spaces will actually start to collapse, and the body, in its attempt to help, will start to put calcium into the area. And we see that on the second picture, a lot of degeneration. And what we mean is a collapsing joint space and a lot of calcium going into the joint. Now, it's very common, but it's never normal to have osteoarthritis. The body is designed to last a long time, and osteoarthritis happens most typically through some type of change in the biomechanics. So you could have, here's the spine right here, you could have a change in alignment in the spine, and what that does is throws off the ability of the bones to be properly lined up. It throws off the biomechanics, and that starts this whole process of degeneration. Many times there's a loss of movement, so that compounds the problems, and the loss of mechanics, biomechanics, and movement in there actually signals the body to try to help or protect. The best way to correct this, of course, is to get the biomechanics back in line, and that's what chiropractors work with on a daily basis. Let's take a look at our next slide. So we see here abnormal joint stress, some type of trauma perhaps, and that could be as simple as poor posture or something dramatic such as a car accident. So you'll have increased compressive forces in the joint, some type of load beginning on the joint. You'll get arthritic changes in the joint, many times pain, but not necessarily, and then immobilization. And once that happens, you'll start to get a thickening of the capsule around the joint surface. Let's focus for a second on just immobilization. See, if two bones are coming together and they're no longer properly moving, they should have range of motion in all your joints, whether it's your spine or your hands or your knees. But if you lose the ability to move properly, this is very significant and causes osteoarthritis. That's why chiropractors recommend as treatment goals to do both adjustments to the area, getting motion back in, and then also exercises to keep the area moving. This is going to be key to the restoration of the joint. Let's look at our next slide. Now, here is a list of symptoms. Osteoarthritis, is this for you? Or is this you, excuse me. Early morning stiffness. Stiff after periods of rest. Pain that worsens with joint motion. Loss of function. Local tenderness. Cracking joints. Swelling of the soft tissues. So all of these findings or symptoms are very familiar to me as a chiropractor. Many of the people that come into my clinic have these type of symptoms. And we'll do an examination and then typically follow up with an x-ray of the spine to examine the underlying structures. And once we have that x-ray, we can actually diagnose osteoarthritis. So some of the symptoms may be present, and then using the x-ray we can determine what state is your spine, how healthy is your spine. If you're losing the natural curvature, if there's a lot of misalignments, that is going to start the process of osteoarthritis. Many times when people come in, we're catching it very early, so it hasn't started yet. So by starting a program of corrective care, we can actually change the biomechanics, get motion back into the spine, and actually prevent osteoarthritis from occurring. Now, if the osteoarthritis is already there, there's also some significant things that you can do, including the adjustment and very specific exercises in order to limit the damage and even correct that area, possibly even reversing the underlying damage. Let's take a look at our next slide. Target sites of osteoarthritis would be typically the weight-bearing joints, the hips, the knees, the feet, the spine, but also the hands. The hands could be involved because you use them so much. Now, once again, it's common but not normal. So why, let's pick the spine. Since I'm a chiropractor, we'll focus on the spine. Why would you get osteoarthritis in the neck? Well, it could start first with some type of trauma, sports injury or car accident, where you're thrown out of alignment. Then once you've lost the alignment in the neck specifically, you could lose your posture. So gravity starts to affect the way your head is positioned, and that basically puts a lot of loading on the joints. See, when you have extra pressure on joints, that causes changes within the joint capsule and actually increases the whole osteoarthritis process. Now, if it happens in the middle back here, typically we'll see people with raised backs called a kyphosis. So we'll see a lot of changes in the spinal position when we see osteoarthritis in the thoracic spine. If it happens in the lower spine down here, we'll typically see it right at the bottom, and that's right where the spine connects to the pelvis. So a lot of times we'll see damage, osteoarthritis occurring very low in the spine if it's affecting the lumbar spine, and that's a lot of weight bearing and support, and that's why it gets affected specifically right there at those joints. Let's take a look at our next slide. Now we have a degeneration cycle. You have a decreasing joint motion, and that's equal to what's called a subluxation, and we'll discuss that in a minute. You've got increased pressure and stress on discs and bones. It destroys the cartilage and the disc, and then you get what's called fibrosis and bone degeneration. Let's talk about the term subluxation. When a bone loses its proper alignment, it may start to affect the nerve, and that is the subluxation process. See, the danger is that first the body gets subluxated, loss of motion, loss of position, and the nerve gets affected. And then over time, if you leave that long-standing subluxation in the spine, then you're going to develop a cavity in the spine, which we refer to as osteoarthritis. When that happens, it actually makes it harder and harder for the nerve to actually do its job properly, to exit from these little holes along the spinal column. When you have a lot of arthritis, it makes it progressively harder, and then may even start to produce a lot of symptoms, such as pain, numbness, tingling. In addition, what chiropractors talk about all the time is it could affect function throughout the body. As the nervous system is impeded, your body will function at a much lower level. Let's take a look at our next slide. Now, degeneration results in possibly inflammation, pain, deformity of joints, reduced ranges of motion, and uneven joint surfaces. As the degeneration builds, you might actually see a remodeling of the bones. See, left unchecked is a very progressive condition. So osteoarthritis will actually change the shape of the bones as the body degenerates. So leaving that cavity there for a long period of time allows the bones literally to melt together. And a lot of times we'll see that on an x-ray where the bones have just come together and you no longer see the joint space in between, or the disc, and you'll lose a lot of range of motion when that happens, and typically it starts to get very painful in that situation. Let's look at our next slide. Breakdown. Is it the result of age? Well, your joints are designed for use, and if they're properly maintained, joints should not show signs of degeneration until 125 years of use. Age is not a factor of breakdown. Typically, people would think that just because you get old, you're going to get arthritis. Now, that may be true. As you age, we may see more and more signs of arthritis. However, if you treat the spine properly, you would have less osteoarthritis occurring in your body. Eventually, if we're around long enough, we'll probably all get some osteoarthritis. The goal is to really limit it early in life and push it back into a much further age, and in this way, it's It's seen as it's a very progressive disease or condition, I like to call it. But age is not the underlying factor. It's more a condition of what you're doing with your life, maybe your activities or your occupation or how much trauma you've been involved in, and then what have you done to correct the problem. So age is not necessarily the #1 cause of osteoarthritis. Let's look at our next slide. Treatment goals: stop the progression, enhance the repair process, and reverse this process. Now we're going to jump to our very next slide here and show you what some people do when they actually have a lot of symptoms from osteoarthritis. And typically what happens is people want to suppress the symptoms. And this slide says at what expense. Typically people are using what's called NSAIDs. And these are drugs, and they may accelerate arthritis and confuse the body's natural alert systems for safety. High doses of NSAIDs actually harm the intestinal tract, and they may result in ulcers. Now, we all know what NSAIDs are. If you haven't heard that word before, that's your ibuprofens and your Motrins and this type of drug, similar to aspirin. Okay? But what we found is that people are taking more and more of these drugs, and you may start to actually injure your gastrointestinal lining. So the goal here, the trick is not to rely on drugs in order to help osteoarthritis. It really doesn't work very well in the long term, because people end up taking these drugs for long periods of time, and the two organs that get injured the most would be your kidney or your liver. And there's a lot of damage that can occur in those two organs, not to mention ulcers forming in the gastrointestinal tract from constant use of NSAIDs. Typically what these drugs are doing is they are reducing what's called a prostaglandin. And your body secretes these in response to pain and inflammation. So the drugs are attempting to decrease this chemical in your body, but they have a lot of side effects. So as chiropractors, don't recommend taking a lot of NSAIDs for arthritic type pains and conditions. Let's look at our next slide. Treat the cause of the disease. Now, typically we would recommend nutrition. So you want to enhance the repair process, and then also look at some of the physical stressors, such as posture and exercise. Some of the things that can go wrong with nutrition is eating the wrong foods, smoking cigarettes, drinking a lot of alcohol, produces things like free radicals in your body. Free radicals actually contribute to cartilage damage. And what happens is they're very damaging molecules that go through the body, and if they're not corrected by the body, they cause a lot of damage to the tissue, and it's actually what causes aging. If you have a lot of free radicals in your bodies, you will age quicker. One of the things that will happen is your joints will be affected. So we want to limit some of the bad things, fried foods, smoking, of course, lots of alcohol, and we want to increase foods that have lots of antioxidants in it. This would absorb free radicals, things like, of course, the vitamins A and E and C, but then also your fruits and vegetables, which have a lot of natural vitamins already in them. Let's take a look at our next slide. You want to enhance the repair, and this is going to mention glucosamine, cartilage extracts, some of the vitamins that I already mentioned, and the antioxidants. Let's talk about glucosamine. This is a natural product that a lot of people are taking now in order to enhance joint repair. And there's been a lot of studies to show that this actually is very helpful. It must be taken typically over a period of months, 3-6 months, and can actually, in many people, actually help the body repair the underlying cartilage damage. So if you have a lot of osteoarthritis, by definition, you have joint and cartilage damage. You're going to want to take some things like glucosamine sulfate, chondroitin sulfate. These products are very good to help repair the underlying cartilage. So from a nutrition standpoint, these are very successful. Let's look at our next slide. Stop the progression. Exercise is certainly crucial. Swimming is one of the best things you can do when you have arthritis. You're going to strengthen the muscles, and it doesn't create as much joint strain. And then isometric exercises are also excellent. And then using light weights is going to be great too. Now, another thing we're going to need to talk about, in order to stop the progression, we have to focus on our posture. And I have a posture chart here, and I'd like to go over to that and show you some abnormal and normal postures. You'll see on the left of your screen is normal, and you'll see the head right over the shoulders. You see the ear over the shoulder here, and that's normal. Typically what happens as we get older is that head gets out in front. We're sitting at desks more, we might be using computers, and as that head gets further and further forward, we get locked into a position of very poor posture. This can create osteoarthritis, specifically in the neck and neck joints. So as we see the whole progression here, posture also causes decay. And it says, to live a long, active, energetic life, few things matter more than good posture. So if we want to stop arthritic progression, we need to do posture-maintaining exercises. As a chiropractor, I'm constantly talking about posture with both children and adults and the elderly. And it's never too late to practice and actually do posture-maintaining exercises. In fact, it's essential if you want your spine to remain healthy throughout your life. Let's look at our next slide. Now, we have rebuilding your joints. Some other things about posture. Instead of just looking at someone, say, sitting or standing with their head in front, we're going to want to watch how we're lifting various packages, or say you're helping someone lift a bed. You're not going to want to do it incorrectly, because that's going to cause tremendous loading on the spine. So, reduce weight carried in front of your body. You want to keep heavy weights close into the body and not far away from the body. So something that's awkward, like this picture with all the big box, not good. It forces the body to lean backwards, lots of loading on the spine. In addition, sitting in chairs, no slouching. And then when you're sleeping, you're not going to want to use a big fluffy pillow. You're going to want to use a small cylinder-like pillow, or no pillow at all, because that helps maintain the proper curvature in the neck and doesn't cause any stress to the neck. No bending or lifting improperly without your legs. So you want to keep your spine straight as you're going down, keep the weight in close, and then lift with the legs, not with your back and arms. And then you want to reduce sitting. It increases pressure on the last 3 lumbar discs by at least 10 times. So there's a lot of things that we can do with our posture in regards to maintaining our spine and thus preventing osteoarthritis, or maybe aggravating an underlying condition. So you could have arthritis, and then you could really aggravate it by doing some of these things on a regular basis. So the trick is, once you do have a diagnosis of arthritis, you need to take certain steps. One would be proper posture. Another would be to get chiropractic adjustments that puts motion back into the spine. Then also various types of exercise, posture maintaining exercises, but also things that increase motion in all of the major joints in order to limit your exposure or the possibility of arthritis starting in some of the other joints. Let's look at our next slide. Function determines structure. Never take your posture for granted. rebuild your joints by using them properly, and observable changes will occur in your structure. So as a chiropractor, we're always relating structure and function. So as I said earlier, a lot of osteoarthritis starts with something simple, okay? It can be a sports injury that heals in a couple of days, meaning there's no pain after a couple of days. But you might have underlying trauma there where you have some misalignment in the spine or one of the major joints, or loss of motion in the ability of the two bones and joints to move properly. Then, of course, if we are involved in very heavy lifting type jobs, we're going to want to watch our posture and our lifting habits in order to protect the structure. You see, if you protect your structure over a long period of time, over a lifetime, you're going to have better function through your body. Your spine is intimately related to your nervous system, and your nerves are what provide all the function in your body. As the messages go from your brain down your spinal cord and out the nerve and back and forth, that's what provides proper function to your body. So the structure of the spine is crucial, and some of the things we talked about today are going to help you live a long and prosperous life. If you would like more information about arthritis, please don't hesitate to call. I'm on Pine Street in Burlington, and my phone number is 951-5700. Thanks for watching, and have a great day.